So a patient lies down and you think about what's going on in their head versus what's going on in the doctor's head. The patient lies there and says, gee, I wonder what the doctor's going to do to me. Whereas the doctor is thinking, what am I going to do for you? Hey folks, welcome back to Bob's Your Dentist, Heartland Dental Center's YouTube channel. Today I wanted to talk about something, sort of hit me just right now, so I thought I should bring it up. And I was cleaning up old papers, and some of those papers are 20 years old, almost, I just business papers and stuff, but some of them had ideas on them. And the ideas were interesting. There were ideas forecasting 5 years, 10 years, 15 years here at Heartland Dental Centre. What hit me was that, wow, geez, I had some consideration for my 30-year-old self, 40-year-old self, and 50-year-old self and onward. So that got me thinking about something, communication. How does communication actually work? Because when a patient comes in over here, they're coming in, they got do the groceries, get their haircut, go back to work or something, pick up the kids, get the teeth done, and go. And that's sort of what's in the patient's mind. But what's actually in the doctor's mind? Well, the doctor is considering the 30-year-old you, or the 10-year, let's just say another way, the 10 years from now you, the 20 years from now you, the 30, up till 100, like when a patient comes in here, I'm actually thinking about you when you're 100 years old, because, we like to see your teeth. They keep all your teeth till the end, and maybe you'll live longer, and that's even better, but we want to keep those teeth. So the question that I always ask the patients is, what are you doing now in consideration for yourself 10 years from now, 20 years from now, 30 years from now? So a patient lies down on the chair, what's going on in their head versus what's going on in the doctor's head. The patient lies there and says, gee, I wonder what the doctor's going to do to me. Whereas the doctor is thinking, what am I going to do for you? That's what the doctor is thinking. What am I going to do for you? How am I going to keep your teeth for the next 50 years? So he's thinking long term, or she's thinking long term. And the patient is too. I'm not saying that always, but normally they're lying there and they're wondering, what is he going to do to me? How much is it going to cost? Is it going to be painful? Communication, folks. This is why, when you go to court or something, or you get arrested, hopefully not, they say anything words you use can be used against you. Why is that? Because when you're about to enter a court, you're entering someone else's game, and the words they use, they are the authors of those words, and the authors of those words know the meaning of those words. So if you are using words that you are the author of, that you understand, okay, this car is blue, that might not be the same when you go out into the court. Because there's almost 7 different interpretations, or 7 different meanings, they say, for each word. So how do you know which meaning somebody is using in the court of law and what you're using? Similarly, when you're with any communication, whether it's with your relationships or with your doctor, is that the idea of informed consent, of communication, of understanding what is your intention, what is the doctor's intention. Like I said, here at Heartland, in our worldview, we're coming back to the same thing, that the best dentistry is no dentistry. And no dentistry means save your teeth, do prevention. But I have to, being the author of that vision, I have to clarify the meaning behind that so that the patient can actually respond back to that accordingly, right? And I don't always perhaps be as clear, but this is where the game is, the constant communication. You are the author of your words. You are the one that needs to clarify the meaning of those words so the receiver can understand it. So again, as doctors, we need to get better with clarifying the meanings of things, trying to help the patient understand, trying to get them to know where we're coming from. And the patient too needs to have enough of that good relationship with the doctor to open up and say, when I don't understand something, what does that mean? What does that mean? And that could be projected for the rest of your life in with every other relationship that you have. Try to think about that next time. Have some consideration. Think about what the doctor, put yourself in, we always say, put yourself in other people's shoes. I constantly try to put myself in the patient's shoes, what they might be thinking. And most doctors do. That's what they try to do. Doctors want to help. They're here to help, believe it or not. So, but try putting yourself in the doctor's shoes and see where that leads you. Try to imagine what they may be thinking other than, hey, it's money bags. Believe me, this is not what's in most of the doctors' mindset. All right. They're trying to do the best they can. What you got to do is think about, okay, how do I communicate? How do I get that knowledge from the doctor so I have consideration for my 30-year-old self, 40-year-old self, 50-year-old and onward, all the way to my 100-year-old self. Anyways, hopefully this made some sense about communication and authorship of words, and work on that communication with everyone, including your loved ones. And hopefully that's your dentist too. Until next time, Bob's your dentist.